All right, how well do your lungs work? Do you even know? It's a question maybe many people don't think of, but we have some people here to tell us the answer to all of that. Joining us this morning, Dr. Topolosky, a pulmonologist from Christie Clinic, also Tara Diskin, I hope I'm saying your last name right, from Christie Clinic as well. And we are here to talk about World Spirometry Day. Tell us what that means and what message you guys are trying to get out there.
Well, World Spirometry Day is actually supposed to be in October.
Okay.
By the American College of Chest Physicians, American Thoracic Society, American Lung Association. And we've decided to make it in June this day because this is when the Olympics start. So we're going to have all these people breathing, running, swimming, jumping. So we thought this would be a good time to have it.
Right,
so,
and all those people inspired by the Olympics to get out there and test their lungs and all that good stuff. All right, so there's a simple test you guys can do, and it tells you all kinds of things, whether something might be wrong or if you need more tests. What are the main things you're looking for when you do this test?
Tara?
The main things we're looking for is how are your lungs working compared to what we think they should be.
Okay.
So we have you breathe through the device, do an analysis compared to what it should be, and come up with your percentage of result. And then we interpret that, or Dr. Topolosky does, and others, to understand what that means.
Okay. And so I'm going to be under the gun, right? I'm taking the test.
Correct.
Walk me through it. How does it work before we start?
It's very simple. It is painless. All you're doing is breathing. You do that every day, but we're just going to emphasize it a little. You should be. If not, you need to come see us. But it's just an emphasis of what you do currently. But I'll have you breathe through this mouthpiece with your teeth around.
Okay.
Your tongue might want to fit in there, so keep it down. We do have you wear nose clips just so that you don't accidentally breathe through your nose.
Pretty.
Yes.
All right.
And the technique is normal breathing to start. Take a deep breath, and then I want you to force it out hard, fast, and as long as you can push. And I'll coach you through it.
Okay.
It'll be easy.
All right, walk me through it. I'm ready.
Okay, I'll be wearing
Robert is standing by in case something goes terribly wrong.
Here, yes.
This is my nose clip.
Come catch her. There you go.
I'm ready.
I'm going to have you hold this just parallel to you.
Okay.
You want your teeth around and lips tight, and then start with normal breathing. Yeah, good posture, so your lungs can expand. And next breath, take a deep breath in. Big, and now force, blast. Long, 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 and squeeze, pushing all the way out. You're almost empty, almost there. Now take a full deep breath back in. Okay, and you can take that out of your mouth and your nose clips off for a little bit, and breathe.
Okay.
See? Not so bad.
No, it wasn't so bad. I'm nervous. What are my results?
Normally we do 3.
Oh,
so we get a consistent reading.
Right, to make sure it's consistent.
So I'm going to have you do another one, and I want you to force it out just a little bit harder in the beginning.
Okay. Okay. Time for the nose clips?
Time for the nose clips. Same thing. Normal breathing. All right, now your full deep breath in. Big. Blast real hard. Push long, long, long. This is great. Keep pushing. Use all those muscles. Squeeze, squeeze, squeeze through. You're almost empty. Almost there. Now your full deep breath. Good, good, good. And rest. That was good. You can rest your nose. We don't have to make her do a third one.
Pretty reproducible there.
All right.
Yeah.
Okay, so
tell me what you're looking at and what you're kind of looking for.
Well, we're looking at the entire amount of air you blew out, forced vital capacity, and you're 101% of predicted. Great.
What does that mean?
That means you're normal.
I'm normal. Robert, did you hear that?
No, I'm sorry.
Yeah,
confirmed.
All right, and then we look at what you blew out in the first second.
Okay.
And you're 95%.
95% normal.
Yes.
Great.
And then we look at what you blew out in the middle, not the first 50%, middle 50%.
Okay.
Okay, and you had 80% of predicted.
Ooh,
normal.
80.
Yeah.
My numbers are falling.
No, that's fine. And then we looked at the ratio of what you blew out the first second compared to what you blew out totally, and that is very important, and you were 81%. That's normal.
All right. So are you looking, is there a way to cheat this?
No.
No.
You can make it look bad, but you can't make it look good.
You can make it look better.
And your coach
So what does it tell you, when you're breathing all that out, what does it tell you? Just how much air you've had in your lungs and how much you can...
it is actually the flow.
Okay.
The flow of air. Okay, and people who have COPD or asthma, their flow is not normal. Normal is greater than 70%.
Okay.
Okay, the most important one is that ratio between the first second and the total. That's the one that gives us the most information. Because you could have a normal blowout total, you could have a normal what you blow out in the first second, but the ratio, if it's abnormal, that's very sensitive.
And what kind of people should be considering having a test like this?
Anybody who smokes, anybody who has asthma, anybody who's short of breath.
Okay. Does that include short of breath when you're running because you haven't run for a while?
No.
Okay.
But
Good.
if you're short
Just
of
want to
breath,
make sure.
if you're short of breath after you run, or wheezing, or coughing, then you should
Right.
have a spirometry.
And this is a really simple test. I mean,
Correct.
I was surprised by how easy it was and how quick the readings come out. How important is this in having people diagnosed with something that could, you know, really save their life if you catch it early?
Most family practices and most internal medicine practices should probably do this on their smokers and their asthma patients.
Okay.
Or people they suspect. If this is abnormal, then of course they need to go see a pulmonary specialist and get a formal breathing test.
Is there a way to expand how much air you can fit in your lungs?
No.
Okay. I don't know if
But-
there was like an exercise, like a
No,
breathing exercise.
But you can condition yourself to do better with the air you've got, i.e. physical conditioning, aerobic activity.
Got it.
Running, swimming, jogging,
So I'm not
bicycling.
off the hook.
We do have
No.
deep breathing exercises too, just
Okay.
to kind of focus on how deep you can take a breath and kind of coach you through those things that we give out to people.
But we can't make you bigger than you are, but we can make you do better with what you've got.
All right, I like that thinking. Along those lines, you guys are putting on an event where people can come and do things like this. We
Right.
have that information that we're going to put up now, but tell us a little bit about it.
Well, it's, like I say, it's World Spirometry Day, so we're offering free spirometries in the lobby of Christie Clinic downtown on University from 8 till 4 this afternoon.
Okay.
And I would encourage people who think they might have lung disease or do have a history of smoking
Right.
to maybe come in and get a test to see if they need to be seen.
Or if you want to see how cool you look in nose clips, head on down. And
Yeah.
if it wasn't cool enough to get this test, you've got another little bribe, free ice cream.
Absolutely.
If you want to mention that as well. So again, we'll put that information up. Thank you guys so much for joining us this morning, and
Thank
thanks
you
for testing out my lungs. I'm glad.
Thanks for having us.
Glad I passed. It's live TV, so you never know what's going to happen.